over 100 years ago, the world was hit with the influenza pandemic, which resulted in the deaths of over 50 million people. Fast forward to 2020, here we are yet again, faced with another pandemic, this one named COVID-19. We're joined by Chief Medical Officer of Trinidad and Tobago, Dr. Roshan Parasram, who will walk us through what it entails in managing a pandemic of this magnitude. Welcome, Dr. Parasram, and thank you so much for taking time out of your very busy schedule to chat with us. I know that it's been an enormous undertaking, you and the members of your team. You hold the position of Chief Medical Officer. You head a team of professionals that has the responsibility of managing and securing this country's health. What has that been like for you?
So, I mean, the scope is extremely wide because, I mean, public health being as broad as it is, we cover a lot of areas. What has brought COVID-19 has brought to life, of course, is what we do for infectious disease, protecting the port health of our country, protected the hospital care, hospital level care as well, but the CMO is responsible for all levels of care, both at Trinidad and Tobago. So the portfolio is extremely broad. We cover, there's a lot of statutes that are placed on the office holder. For example, the Quarantine Act, which the population is familiar with. The CMO also acts as the quarantine authority for Trinidad and Tobago. I am also the international health regulation focal point for Trinidad and Tobago, which is a PAHO position that actually each country in the PAHO or WHO organizations have to have a focal point in the event of international disease of concern, for example, COVID-19. So it is a broad portfolio. We have a number of vertical units outside of that particular communicable disease listing. For example, we have chemistry, food and drug, which is responsible for drug registration and regulatory agencies. There is other agencies, of course, vector control is under my remit as well. A number of PMOs, we have a PMOI and 3 others that actually come under my control. So directly under me, I would say we have over 25 units that I supervise directly. But the scope is extremely broad and it encompasses all of the health sector.
My experience, 2019, late 2019, I would have been looking at international headlines,
right,
and this invisible virus is attacking China.
Right.
When did COVID-19 or managing COVID-19 begin in Trinidad and Tobago?
So I think early on, following the disease trends, and as the IHR focal point, we would have been given updates from PAHO about any new virus that's circulating in the world. So through the communication from PAHO, WHO, it will trickle down to all the countries. And we would have, of course, looked at international news as well to see what was happening in Wuhan, China. So around December, I would say, of 2019, that is when we actually saw news of this new virus that was circulating in Wuhan and causing a high degree of mortality and morbidity. And of course, it was of concern for all of us in the world. We began to track its progress as it was being controlled in Wuhan, and to be honest, see public health measures used in a way they haven't been used for quite some time in Wuhan and in China. What we have seen before, similar, is what happened with SARS many years ago. Similar sort of control measures were used in China and other parts of the world for SARS. And another virus which continues to be in the Arabian region called Mediterranean MERS, which is a Mediterranean respiratory virus, similar to SARS. And it is something that we keep a track of all the time. But again, it seemed to all of us in the world that it was moving at such a fast pace in terms of spread. WHO said in the early days that it was looking like case reproduction rate upwards of 2.5, even higher, meaning that one person infected would infect 2.3 to 2.5 persons. We have seen different strains over the months that have now been defined, and we see some of them being more infective than others. So the movement of this virus is much faster than we have seen in a long time. And of course, the mortality rate is higher than influenza and other respiratory illnesses.
So you're talking about how quickly the virus is spreading. You're talking about the increase in deaths over this period of time. It has not yet hit Trinidad. Yeah. What is going through your mind?
So we began the planning phase. Planning in 2 broad categories. So one, how can we keep this virus out of Trinidad? So Trinidad being a small country, in terms of resources, in terms of size, we have to look at and what we were seeing in Wuhan is that there was outstripping of their hospital capacity very quickly. There was outstripping of their public health capacity. And for a country as developed as China, to see that, and being in a developed country with limited resources, of course, it is extremely fearful for us to look on and see that a country as well resourced as China will be in that difficult position so quickly with a new virus. So our first line of defense, of course, was to restrict our borders and to hold our borders as best as we could for areas that would have possibly led to importation of the virus. So what we did very early on, and the first strategy we took is I recommended, and the minister acceded to my request to take a note to cabinet that we actually restrict travel from China for anyone that would have been in China for less than 14 days. Meaning what we knew early on, of course, that the incubation period was thereabouts 14, and we use that as our benchmark. Hopefully thereby decreasing the likelihood of anyone coming from Wuhan and actually coming to Trinidad. Knowing fully well we have a large contingent of people that go between China and Trinidad on a daily or weekly basis. I made a recommendation to PAHO, WHO, as well as Cabinet, because as the focal point, you have to justify to PAHO if you do anything to impede travel or trade restrictions in your country, you have to say why you do it. So I made the recommendation based on the fact that we have increased travel to that part of the world. There's no vaccine, there's no specific treatment, and the mortality was very high at the time. So again, we are a sovereign state and we can make that decision. So we took a note to Cabinet, and Cabinet agreed to do the closure. Initially, I believe it's on the 30th of January, to have our borders closed to China for international travel at that point in time. What we started to do shortly thereafter, of course, is look for cases in our population, because prior to that, there would have been people coming from China into Trinidad. So we tried to build the capacity for our lab system. The Caribbean Public Health Agency started to test for the region, and they were responsible for the region on February 7th. So once they started to test, we started to send our suspected cases to CARFA. Between the time we got our first case and February 7th, we would have tested over 50 persons, all of them coming back negative. And all of us at the ministry, of course, holding our breaths when we got the results back from CARFA, as each one came back as negative. It was really just waiting and seeing who would be our first case, because we expected that we will get our first case at some point.
So there's a level of concern, but would you say at that point in time there was any panic among you all?
I don't think we had gotten to the stage of panic at that time. I think we were trying to prepare as best as we could. We looked at, there were some things that were outside of our control in the terms of a brand new virus. Testing will also be something that is difficult for any country to build capacity. Just because it is a virus, you have to be able to build the technology very quickly to detect the virus, so that takes some time. And we had to rely on CARFA in the early days to do our testing. So they had a ceiling, of course, of how many people they could test per Caribbean state or CARICOM state, and it limited our ability to really send samples across in the early days. But we sent all our suspected cases. The case definition in the first month or two was basically anyone with travel to China or Wuhan in particular within 14 days prior exhibiting flu-like symptoms. So anyone that would have met that definition went across the CARFA, they would have tested, and again, our first case we actually got on March 12th.
Right, so March 2020 comes and we record our first positive case. What's happening behind the scenes? So
we expected it. Of course, we expected to get a case at some point. It reminded me very much of Zika, because when we had Zika, we saw Zika strangely come from up the islands. It came from Jamaica all the way down and came from one island to the next, because it's a vector-borne disease. It behaves a little bit different. And eventually Trinidad got it. So all the islands became positive and then Trinidad got it. So it was similar, but of course the movement was a little different. So we prepared by way of press releases. We prepared as to how we were going to present it to the population in a way that will inform them as to what is happening most transparently, and at least give them some assurance that the systems can cope in the early days. So it was a lot of preparation in terms of communication, how we're going to communicate the news, and of course, how we're going to treat those initial cases that we got.
Of course, a lot is still happening at that time. Schools close, and then comes the first death. What is the feeling among the members of your team at that very point in time?
Right. So, I mean, just building on the first case before we had the first death, I remember before, as you mentioned, schools closed, they informed me that they were going to swab this guy who had come back from Switzerland at the time. So my medical officers called and they said it looks like COVID-19. We tested him and it turned out to be positive. We had a press conference later that day to let the population know we had our first case. We defined it to some extent. The school closure came out of his children being present at one school in particular, which we closed right away. And then shortly thereafter, we closed a lot of the schools because there was a university connection as well. So school closures came very quickly and as one of our first public health measures aside from border closure. Also, what came before is, of course, the proclamation of COVID. At the time, it was called coronavirus by the president. Based on a request, the way it works in the law is that the CMO has to do an order to the president. The president does a proclamation saying that the disease is now a dangerous infectious disease under the public health ordinance. And that gives life for us to be able to do public health regulations, as now is common in the population. We're taking public health regulations all the way up to closures of schools, closure of restaurants, whatever we want to do to restrict spread. But it's based on the premise that the president has already proclaimed it as a dangerous infectious disease. So it was a necessary legal step that we took early on. I believe it was on January 31st.
Even with months gone, the disease new to us, new to the world, I would imagine that it has been a stressful period for both you and other frontline workers. Right. What are some of the coping mechanisms that you all employ just to deal with what you all are faced with?
I think in the first few months, I would say February, March, April, thereabouts, maybe into May, we weren't thinking about personal stress levels. We were trying to put things in place that would deal with the virus, at least from the ministry's perspective, to try to build hospital capacity. When we had our first case, we had 4 beds for treatment of COVID-19 cases at Cora in a specific isolation room. We had to rapidly build capacity to have more cases be seen in hospital, as the policy was to bring everybody into hospital to treat in the first instance. So we were consumed, I think, almost as like soldiers being in a war. We were consumed with the battle against the virus, planning. Most of us got by with 3 to 4 hours of sleep for months on end, for healthcare workers, for other frontline staff of national security as well. So I think it was more about planning and processing, and we let ourselves go to some extent and just continue to work continuously.
In your estimation, how robust is our healthcare system at this point in time?
So I would say our health system is extremely resilient by way of our human resource in particular. And we have seen, I said before, at any time during the pandemic, I have seen any member of staff back away from seeing a COVID-19 case. And I think the strength of our system really lies in our human resource capacity, because our nurses, our physicians, our frontline workers have stood up to the test. And it has proven to be a resilient system. Any system can be overwhelmed. I mean, we see large capacity systems in the US, in UK, and other parts of the world being overwhelmed. They have no ICU beds. They can't see normal patients for any other means. So our parallel system, which is a system trying to keep infections out of the hospital, has gone a long way in preventing unwanted healthcare workers getting infected and other patients getting infected as well. So the setting up of the parallel system began because we had Cuba and Arima coming on stream and then Point Fortin. So we were fortunate that they were almost there for completion, and we were able to quickly turn it into COVID-19 hospitals.
Allow me to commend you. Throughout all of this, you have managed to remain really optimistic. What gives you that inspiration to keep pushing and remaining positive all the time?
Well, I think one, my background, as I described before, having worked in emergency departments, you sort of have that seeing severe disease, seeing gunshot wounds, seeing near-death experiences all the time, and then, of course, as a DMO, seeing suicide and murder and sexual offenses. It puts you in a frame of mind to deal with that sort of tragedy. And, the training goes a long way later on when you have that sort of... But I think what allows us to continue is having small wins. When you have a day that you have no deaths, and you look at... I get notified of every single death that we have first. When you have a day that you have no deaths, a day that you have a low number of cases, those things motivate you to push on and to go forward. So baby steps, one day at a time, sometimes hours at a time.
Managing COVID-19, I would imagine, is a great undertaking. Would you say that in the middle of all of this, or in between, you've managed to have one or two good days?
Yeah, I think the days, as I said, the good days are defined by the clinical outcomes that we want. We had a long period, I would say, somewhere between May and July, where the country would be in a sort of state that was isolated from the rest of the world. Our borders remained closed. We had no cases for upwards of 80 days. So it was a good time, and a time for the health system to continue to build its capacity. We continue to work to do that, but of course, having little or no cases, it gave us some downtime, even at the hospitals. The hospitals were empty, to recuperate and recharge all of us. So it gave us some respite in the middle of all of it.
A lot of people have also taken note of your demeanor. You've been described as calm and well prepared. What do you attribute that to?
I think the years of working, as I said, in different circumstances. Once you work in an accident and emergency department, which is emergency after emergency occurring, and having done it for many years, you find that you are able to deal with emergency situations in a good way. And having dealt with Zika, I would have mentioned chikungunya. I was on the front line with Ebola in 2014 as well, when we had the scare of Ebola. There was SARS, there's consistent threats of MERS every year. So having dealt with those before gave me a little bit of comfort that we were dealing with it's a new virus, yes, but it's a respiratory virus that is similar to SARS and similar to MERS, other coronaviruses. So we had some knowledge of what was happening. And of course, having the technical backing of the other staff of the ministry, I thought we were in a comfortable place by way of technical knowledge in the ministry to make the appropriate decisions.
The Ministry of Health cannot emphasize enough social distance, sanitize, wear your masks. Yet still we see numbers, they dwindle. Sometimes they seem to be increasing. Is there anything else that you feel can be done at this point in time to bring our numbers down?
Well, I think as we stand now, our numbers over the last 3 weeks or so has been in decreasing significantly. We had legislation for masking on August 26th, I believe it was, for mandatory masking, which has gone a long way, and I think we're seeing the benefits of it now. When you ask for herd immunity in a population, you ask for something upwards, WHO has recommended upwards of 70% for vaccination. Now, mask wearing is akin to vaccination to some extent. It gives you protection in the public spaces, and I think what we're seeing now in the lower numbers are really attributable to how people are wearing the mask, and the large majority of people are wearing it effectively and appropriately. We have, of course, people wearing it still on their chin, wearing it over your mouth only, but it seems to be an ever dwindling population. People are really going into the new normal. Even in my own office, a couple of months ago, people wouldn't wear their masks at their cubicles. Now people are wearing their masks at their cubicles. The only time they take it off is when they eat. So I think the mask wearing has gone a long way. And what we're seeing today is probably a function of mask wearing in the country.
2021 is fast approaching. What are some of the ministry's plans moving forward? I know there's talk of the vaccine and all of that.
So I think there's parallel tracks. One, to maintain the gains we have made by ensuring that the public health measures continue. So the communication strategies are the key, making sure that people continue to wear your mask appropriately, continue to social distance, understanding that we will have to do so for quite a while until we get either to a point that the pandemic is gone by way of herd immunity from infection or vaccination. The main focus now at the ministry is really acquiring a vaccine that is WHO approved, and of course building strategies to distribute that safely, effectively and quickly to the population to ensure we have the coverage that we want. The first phase of vaccination is going to be to protect the vulnerable healthcare workers. We're going to look at elderly over 60. We're going to also do persons with NCDs, diabetes, hypertension, cancers, as well as immunocompromised people. First phase is really protecting the vulnerables. What it does is, although we have infections, you don't have as many deaths. You don't have as many hospital days. The second phase, once we get enough vaccines, will be to move towards herd immunity.
So before we end, I'd like to thank you again for making the time to chat with us. Is there any special message that you'd like to convey before we close?
Basically, I just want to thank the population for abiding by the public health regulations to the most part. I think everyone has done a very good job. And really over the last month or two, I've seen a great improvement in the way people are abiding by it. We know how to adapt to the new normal. So the population is one. Healthcare workers and other frontline workers have done human service throughout the pandemic and continue to do so. And I really want to publicly thank the healthcare workers, persons from national security, defense force, police, and other entities that have supported us greatly. Those persons I want to thank, and I just want to say, I believe COVID-19 will do for public health what 9/11 has done for global security in changing the way we view public health in the world.
Thank you, Dr. Parasram, for joining us. And there we have it, Dr. Parasram walking us through what it's like managing COVID-19 in Trinidad and Tobago. Thank you so much for joining us. And before we go, we'd like to remind you, maintain your social distances, hand sanitize regularly, and remember, wear your masks.